Hello, good morning guys. Assalamualaikum. So today lecture is on benign white lesions. Okay, white lesions is basically referring to any types of whitish presentation or lesions inside the mouth, regardless the size of the lesions. Some of the white lesions can be mixed with some reddish appearance. Okay, and at the end of this lecture, you should know which disease or lesions that is, not dangerous. For example, which is caused by friction or trauma, and can be treated by removal of the irritants, and know which lesions that is precancerous that need treatments. Yeah, and this white lesion can have various of appearance. Okay. White lesions usually represent some form of mucosal thickening or growth that can be seen in the histological appearance. Okay, the epithelium is hyperplastic, usually, and most of the white lesion we can categorize into two types. One is can be rubbed off or scraped off, and another one is cannot be rubbed off or cannot be scraped off. Okay. The one that can be rubbed off includes material alba, pseudomembranous candidiasis, or chemical burns. Yeah, and the one with cannot be scrubbed off includes leukoplakia, okay, which is precancerous lesions or premalignant lesions. You must correlate clinical informations from the history of the patients, and some of them may need biopsy in order to get the definitive diagnosis. And some of the white lesions of the oral mucosa has some association with skin lesions. Yeah. Okay, we start with the first category, which is the hereditary white lesions. Include leukodema, white sponge nevus, hereditary benign intraepithelial dyskeratosis, dyskeratosis congenita. In this lecture, I will focus on the common lesion, which is the leukodema and white sponge nevus. So let's start with the first one here, which is the white sponge nevus. As you can see here, it is a diffuse white lesions on buccal mucosa. You can see cracks here, so it looks like shaggy looking wavy appearance of whitish lesions. This cannot be scraped off. How do you know? You just take wet gauze and try to rub the lesions, and if it cannot be rubbed off, so that is one of the criteria of white sponge nevus. Okay, so this is a rare lesion, a benign autosomal dominant condition affecting the non-keratinized stratified squamous epithelium of the oral mucosa, which means gums is much rarer. Okay, but other mucosa like lips, floor of the mouth, buccal mucosa is quite common for white sponge nevus. It is usually bilateral. Yeah. And histologically, if you can see here, okay, whenever you want to describe oral mucosa histologically, do it systematically. So first we divide into two, epithelium and connective tissue. Okay, in this white sponge nevus, we focus on the epithelium, right? It has a epithelial thickening, so the epithelium is thicker or hyperplastic than the usual normal oral mucosa. Look at the top here, the slightly striking pinkish than the rest of the epithelium. There's some hyperparakeratosis with pycnotic. Yeah, if you can see the pycnotic or nucleus that has been squashed, dah penyek the nucleus, that is the parakeratosis layer. Some vacuolizations. You can see some appearance with clear, slightly clear cytoplasm area at the center here. At the suprabasal, what does it mean by suprabasal keratinocyte? Keratinocyte just basically means the cells of the epithelium. Supra means upper. Basal, this is the basal region. So above the basal region, okay, you can see the vacuolizations. And the diagnosis is established during the early childhood, and treatment is not needed. Just give some reassurance to the patients. Yeah. Next lesion is leukodema. This is again on the buccal mucosa. As you can see here, there's some velvety, grayish, have some wavy appearance, if you like, okay, of the buccal mucosa. This is a typical looking leukodema. So leukodema is a common mucosal alteration, represents a variation of normal condition. It is actually a normal lesion, okay, but the characteristic is different. Okay, mostly buccal mucosa and mostly bilateral. This leukodema can be found mostly in African Americans. In Malaysia, Indians have leukodema usually. Again, it's showing grayish-white opalescent hue. Prominent lesions may manifest as wrinkle appearance or wavy appearance, cannot be scraped off. Okay, so the simplest trick is to stretch the buccal mucosa and the lesion disappear. Okay, that's the characteristic of leukodema. There's no treatment needed. Just reassure the patient that the condition is, normal, right? So the next category is reactive or inflammatory lesion, which includes a long list here. Okay, let's start with linea alba. These lesions exist in you, in me, in many of us. Okay, in fact, in 13% of the populations, in which there's a prominent whitish lines along the occlusal plane. So the lines here, it can be straight or slightly rugged, like this picture here. Depends on the occlusion of the patient, right? Right, so this is a whitish gray horizontal streak on buccal mucosa, oriented parallel to the adjacent occlusal plane of the teeth. Okay, so usually bilaterally, may associated with pressure, frictional irritation, or sucking trauma. What does this mean? In some patients, they have some habit, they like to sucking air inside the mouth, whereby the soft tissue or the buccal mucosa being drawn into or towards the middle of the mouth, so that the linea alba will become more prominent, yeah, and also in the individuals with reduced overjet, yeah. So it's quite common, 13% of the population, and just reassure the patients, no treatment needed, don't biopsy. Okay, next lesion is cheek chewing. Okay, cheek chewing, as you can see here on the label surface of the patients, there's some whitish shaggy appearance, and then in this area here on the buccal mucosa, again much thicker shaggy whitish lesion, yeah. So what is cheek chewing? Cheek chewing consists of a few types. Moschia shobacarum on the buccal mucosa, Moschia linguarum on the tongue, Moschia labiorum on the lips. Okay, this is a self-inflicted trauma. Patient may have some association with psychological stress. Usually, most lesions occurs on the buccal mucosa. Other areas includes cheek, lateral tongue, and lips, and mostly seen in women. Right. As you can see in the histology, this is only the epithelium part. Okay, some spiky looking appearance on top of the surface. This is keratin projections. Okay, and the parakeratinized area is quite thickened, hyperparakeratosis. Acanthosis referring to the ridges which you cannot see in this picture, yeah, right? So this whole thing is hyperplastic, or increase in thickness. Right. So the diagnostic is to correlate the history of the patients with the clinical presentations. Okay, and treatment is not necessarily, but in severe cases you may need to refer patient to medical professionals for some counseling or psychological advice in order to investigate more on the behavioral habit, yeah, right. So next lesion is nicotine stomatitis. As you can see here, the lesion is on the palate. Okay, it's a combination of whitish lesion and red lesions. The red dots here are actually the inflamed openings of salivary minor salivary glands. Okay, so what is it actually? It occurs on the hard palate of pipe, cigar, or cigarette smoking patients, areas exposed to the concentrated hot smoke. So when patients smoking, the heat from the cigarettes or pipes or cigar will induce the inflammations of the minor salivary glands. So hence the appearance of the many red dots, yeah, or the what we call it punctate red centers. Okay, so mostly in men older than 45 years old, or anybody who smokes, yeah, who smokes a lot for a long duration of time. Okay, again, histologically, some epithelial hyperkeratosis. Okay, inflammation with inflammatory cells, chronic inflammatory cells, and squamous metaplasia here is due to the heat may transform the normal structure of the epithelium cells into some other different type of cells. Yeah. So the diagnosis is by correlating history of smoking. So patient must have a history of smoking, and then we'll see the appearance. It's a quite classical appearance, yeah, very specific appearance of the nicotine stomatitis. Okay. This lesion is not considered a pre-malignant lesion. Yeah, it can be reversed. So how you advise patient to stop smoking. Okay, 2 weeks after discontinue, severity of inflammation is proportional to the duration and amount of smoking. It takes time lah. Okay, you have to biopsy if after a patient stop smoking, the lesion tak reverse. So so we advise for biopsy. Okay, because we afraid that it can be some other bizarre lesions. Yeah. So let's have a look at this one here. This is nicotine stomatitis, which is not pre-malignant lesions. This is different. This is caused by reverse smoking, whereby the patients have a habit of placing lid end of the cigarettes, cigar or cheroots inside the mouth. This is a risk factor, or sorry, this is a pre-malignant lesions whereby it can transform into oral carcinoma. Okay, definitely need biopsy for that. Right. Okay, for the first part, we shall stop here. Most of the lesions that we discussed earlier on are benign lesions. So I'll see you in second part. Thanks.